Hi, everyone, and welcome to the HC Biz Show, the podcast dedicated to unraveling the business of healthcare. I'm your host, Don Lee, and above me or beside me, depending on your view, if you're on YouTube, is my co-host, Shahid Shah. Welcome, sir.
Hi there. Yeah, people have been asking for a while about why we haven't done videos, and I've always reminded them that you've got a face for video, but I've got a face just for audio, and that's why we haven't done a lot of videos in the past. But there's a lot of benefit for doing video, not the least of which is people get to interact with us a little bit better visually. But I think we can start to do demos and show things off in the future through things like screen sharing. And as we have other guests, maybe they would enjoy being on video as well. So it's a good start for us here as an experiment. And if the audience likes it, they can benefit from the video as well.
Absolutely. And this will be also going out on our regular audio feed. So many of you will obviously be listening there. If you want to check out the video, you can find us on YouTube under the HC Biz Show, and vice versa. If you're on YouTube and this is the first time you're discovering us, go check out the audio feeds. There are 135, 6, 7 episodes, something along those lines when this comes out, that we cover all manner of the business of healthcare, helping you to understand why is it difficult to innovate in healthcare? How do you make things work with the business of healthcare so that they can be sustainable, they can grow, they can get traction, you can get the support of the people that you need the support of to make things actually happen in healthcare. So we take a very practical approach to everything, and that's what you're going to see here from us today. So the topic that we've been in the midst of for the past many weeks is focused around reopening. In the stage of COVID crisis that we're in right now. And we've covered things like, if you're a doctor, what should you be doing right now? How do you engage with your patients? Provide service at a very high level while maintaining social distancing, et cetera, et cetera. We've talked about marketing and how do you change your messaging? Do you need to change your messaging? Especially if you're outside of something like a telehealth, or today's topic will be remote patient monitoring. If you're outside of one of those things that are really key to what's happening right now, where everyone's really focused on with COVID-19, what should you be doing? How do you engage with people? And we've covered, how do you keep your innovation engine humming during the crisis? So what we're going to do today is a bit of a blended topic, a little bit different, but where we're going to start is for all of us, is as individuals, as we start to go back to work, and I know some people already have started to go back to work, many of us still working remote, but will be in the coming weeks and months, re-engaging in an office space with people, with our employers, with our coworkers. And we want to talk about how can you start to prepare yourself for that? What are the things you need to be looking for from your employer? What are the things that you can do on your own to keep yourself safe? And we'll kind of, again, we'll be talking a lot about remote patient monitoring, or RPM, obviously a hot topic right now. Huge opportunity for those of you out there who maybe are in the IoT space, have been for some time, but have not broken into healthcare yet. What are the opportunities there for you? So we're going to cover a lot of ground on that front. Shahid, I know this is an area that you spend a lot of time working in, thinking about. I want to kind of hand back to you for a little more framing and to start talking about that. What should we be looking at when we start to go back to work?
Yeah, it's a great point to bring up. And one thing, just from a general disclaimer, is neither one of us are physicians, so we're not going to give you necessarily medical advice. But these are, mostly common sense type of things, but with a few nuggets of things you may not think of on your own. So a few weeks ago, Rob Havasey, who's at HIMSS, wrote a nice article about how you can get equipment, or not necessarily IoT connected equipment, but what is the kind of stuff that you should have at home. So as many of us know, decades ago, anybody who had a thermometer at home was thought to be advanced. And now if you have a child at home, or even yourself, and you don't have a thermometer to check your temperature, people would look at you weird and say, what's wrong with you? Why don't you have a thermometer sitting at home? Some of us have digital thermometers. Some of us have digital thermometers with Bluetooth, and others have digital thermometers with Bluetooth that record things. So starting in that light, what we want to make sure is, all of us should think of a pulse oximetry device, which basically measures, for just lack of a better word, our breathing, right? I mean, how well we're doing as far as respiration is concerned. So that's one of the main things that you want to do when you're trying to prepare for going back to work and going back to a non-necessarily fully social distance environment that we've been in sitting at home. So just like I have and others have, just start with a thermometer. If you can get a thermometer that can record your vitals, meaning your temperature settings, as part of a device or on your mobile, that's great. A pulse oximetry device also works the same way. Either you can buy one that just gives you a numeric value, or it will record into a mobile app. So when you look at these two things, the additional kinds of things is, like, for example, I have scales, digital scales, to watch, how much your weight is going up or down. And normally, people do that as far as those that want to just maintain their weight or understand what their exercise regimen is working like. But in this case, if you ended up with a problem related to COVID, et cetera, weight loss, fast amounts of weight loss, in fact, is something that lots of people are seeing as symptoms. So having a scale, and again, if you have a regular scale, that's fine. You just write down what you're seeing as far as the numbers. But if you can record it using Bluetooth, like I have one that's less than probably $60. It has a Bluetooth so that it records it on the scale. When you bring your phone near it, it'll upload the settings, and then you can do it for multiple people in the house. So these kinds of things, like scale, and then the pulse oximetry thermometer. Of course, if you have diabetes, a glucose monitor. In the normal glucose monitors already do a pretty good job of giving you a digital value. If you can get one with a Bluetooth that connects to your mobile device, that's even better. And one thing you can start to see before I talk about other devices is the pattern here is getting information before you have to talk to your doctor. Because if you can't go into the doctor, which, like, let's say that the cases start to increase and hospitals get overrun in certain areas, which is, by the way, happening again as we speak. So in those cases, the hospitals are going to tell you again, don't come in unless XYZ happens. Well, if you have not been recording, if you don't know what your pre-COVID temperature normally is, or your pre-COVID weight is, pre-COVID pulse oximetry, then you can't really tell your doctor, hey, I've been tracking, once a week, 5 times a week, et cetera, and here's what my numbers used to be. Now I think I might have COVID, and here's what my numbers look like. What's happening, which we've talked about, Don, you and I, over the last few weeks, is the telemedicine side has exploded quite a bit, and physicians are willing to come on and do a quick diagnostic with you. And the more you have sitting at home that can give them as far as data, the better they can help you. So if you were to walk into your clinic, your doctor's office today, they would have all kinds of equipment to just check your vitals, and literally all the same stuff we're talking about you can do at home. But the most important thing is to try to have it before you get sick.
Right.
And simultaneously try to capture your numbers. Like, a lot of people believe that your temperature, 98.6 somehow is some equivalent for everyone. And it's not.
Right.
You may have half a degree lower, or half a degree or 3/4 of a degree higher for your just normal everyday kind of working situation. So if you knew that in advance and then you got sick, and let's say your temperature showed as 97.4, well, that could be normal for you. That may not be outside of the norm at all, but you wouldn't know that if you did not try to get that in advance. So we're going to put in the show notes Rob Havasy's article that he wrote for HIMSS a little while ago. It's a really good article which talks about a lot of these same kinds of things. So the other thing to really think about as you consider whether or not you are, especially if you have chronic conditions, et cetera, you may want to consider thinking about asking your physician in advance for oxygen equipment. So there have been good amounts of research showing that certain folks who have been given oxygen early, then they show different kinds of symptoms. Again, this is not medical advice, this is equipment. You can't just go pick up oxygen supplies. You have to go to usually a durable medical equipment, DME facility. And those DMEs are kind of like where just like you go to a pharmacy to pick up a prescription, you go to a DME to pick up equipment that is prescribed to you. So, for example, a wheelchair is usually picked up from a DME, crutches, et cetera, and things like oxygen supplies and related kinds of respiratory kinds of equipment is also picked up from there. So, if you're, if you're normally healthy, oxygen isn't the first thing for you to concentrate on. It's the other IoT devices that we talked about. But if you are, you are a patient that has had pneumonia before, a patient that has had respiratory issues before, you're diabetic, other chronic conditions, ask your physician in advance. And this is the most important thing: is ask now before you need it. So that you're not having to scramble to get it later on. So your physician will most likely know whether or not having some oxygen type of equipment might be useful for you. So as you look at these kinds of things, and really what we want to do is not just be worrywarts, right? I mean, in these cases, being prepared is very, very important. And so that's the equipment side. The thing to do when you're looking to go back to work, and as we talk to employers and CEOs, and we were doing presentations in front of board members about how do they prepare to open, the main thing is that I have not talked to a single CEO, single senior executive, single board member who's not worried about how to make their employees feel safe. However, there's been a big difference between the best of these guys and the worst of these guys, quote unquote. The best of them actually have very good plans for how they're going to open, what they're going to do with their desks, how they're going to get the personal protective equipment. Are the masks going to be available at work or not? So let's talk about that a little bit and say, imagine if you were going to a restaurant. If you were going to call the restaurant in advance and ask them, hey, how do you take care and make sure that food is prepared in a safe manner? Any restaurant that should be open and not be closed by the health department would be able to tell you that. They would be able to tell you, well, this is what we do. This is how we maintain safety of our food. This is how we make sure bacteria doesn't get in. This is how we make sure we wash our hands. All of the preparations for how you do food safety is a good analogy for how all of us have to be appearing now at work, right? So, for example, if you are in an office building in which your office shares a restroom with multiple offices, your boss might be great. He's got all the personal protective equipment in the world. He's got you fully safe inside your office. But then you go to the restroom, which is managed, of course, by maybe your landlord. If the landlord isn't managing that restroom, or the other people, the other offices that are using that shared restroom are not managing safety in the same way, well, you've pretty much lost, all the safety that your great boss was doing. So the best thing to do in these cases is ask your employer, what are the plans for non-shared areas, which they have full control over? But even more important is, what are the plans for shared areas where you have little or no control over? How much of this has the discussion happened with the landlord? How much has the discussion happened with other folks around you who are sharing maybe equipment? They might be sharing things like restrooms, lobby areas, etc. So when you're at home, definitely have this equipment like we were talking about. But when you're going out to work, and many of us are seeing that are, whether it's the mall or whether it's a restaurant that we might frequent, don't go there until you call and ask, what are your safety and other processes related to COVID-19? And if they say what safety processes, don't go to that place, right?
Yeah, sure, sure.
You want to make
you
sure
can't just assume everybody's following the rules and thinking through all these steps. And, certainly like that applies to the restaurant, and then applies to, your point, asking the boss about it. If they don't have good answers, that's indicative of the fact that they haven't thought through these things, and that should give you caution, and, from the home stuff, you said at the beginning when you were talking about the employer, making your employees feel safe. And I think that's a huge, huge aspect right now, is that while I think the fear has come down over the last weeks and months, certainly as we've understood things better and we've figured out that the hospitals are, as you said, the numbers are going up, but we haven't seen that widespread just overflow at the hospitals, which at the end of March, we had no idea that whether we were going to see that or not, and certainly like New York City had some problems outside of that, that major hotspot. For the most part, by and large, we've been able to manage so far, but that fear remains. And if your staff is coming into work and they're uncomfortable, that's going to impact them in so many ways. It's going to, to be cold hard business about it, it's going to certainly impact productivity. It's going to make some of them not want to come back, might make some of them leave. So these are really important things to be thinking about. And when you think about the home equipment too, same thing. You might want to be monitoring and getting that baseline, pulse ox percentage and baseline temperatures and watching it, just because it's going to give you peace of mind. And that's if you're at home with small children like I am, if you have elderly parents that you care for, all those things, those are the people that are really worried, are the ones that are like going to see 90-year-old grandma and making sure she's got her grocery and all that. Monitoring that stuff on a day-to-day basis could give you that peace of mind that says, everything's been stable, I'm good to go. I'm don't feel like I'm putting her at risk as much. But on the flip side, if you start to see some of those numbers fluctuating, then maybe you make alternative approaches to caring for that person. And it's just, again, peace of mind, just being smart, being prepared, not operating in fear all of the time, but also not just taking things for granted and, going out on a whim.
Yeah. And especially, I think your point was well taken, is if you are responsible for taking care of others, buy them this equipment, right? If you've got the means and ability to do so, things like, and so we stopped at the pulse ox and the scale and the glucose meter, but you've got other equipment like, for example, blood pressure. So blood pressure monitors and cuffs are now pretty inexpensive. And because blood pressure you don't do all day long, you don't have to get it with the Bluetooth and the connected, but whenever possible, if you have a choice and if you have the means to buy it, get one with the blood pressure that can emit to your mobile phone and get stored in your Apple or your other environments. Then there's the ability for you to do even ECGs remotely. So there are devices that you can get right now, some with prescription, some without. One that we got for our parents and family members is it's sort of like a remote stethoscope. So you can put the stethoscope, record it. It'll record in a high quality audio. And then you can then send that to your doctor and say, okay, this is my heartbeat over a 2-minute period in the mornings. And then, of course, you have the devices, for example, like a LiveCore, which can actually do a full multi-lead ECG. It's not going to be as good as the one you get at the hospital, but very, very close in terms of remote needs. So if you think about almost everything that you would do at a normal emergency room today, if you walked in and you said, okay, well, they can do an ECG for me, short of the lab test, right? They're not going to drawing your blood and sending your blood up to somebody that still requires, and I'll talk about that in a second. But the short of the blood draw, almost every other test that they do for you is now possible for you yourself to buy and use at home, which is why, as we talk about remote patient monitoring over the upcoming episodes and this particular conversation as well, we'll see this is not something far off in the future. Telemedicine is here yesterday. Forget today and tomorrow, right? Telemedicine is here yesterday. What's lacking is what I refer to as telediagnostics. So you may have seen, Don, as you get on with doctors right now, they're still learning. They're getting an idea about how to do telemedicine. And so we have to be cognizant of that, as they're human beings on that end. It's not like they've just been doing this for years, mostly because reimbursements and other things haven't been there. But they're getting better. Now the problem is, so for example, if you were to go onto telemedicine and you had super high quality video and wanted to show a skin rash, that would be great. But if you got onto a telemedicine video visit and you have a 14-year-old video device that barely works and everything's fuzzy, how is the doctor's telemedicine going to help you? And it's not, right? If you can't hear you, if he can't see you, so get a reasonably new camera, get these other pieces of equipment that we were talking about, and that's really, really fairly straightforward. Again, if you have the means, we're not saying everybody has the means, but if you have the means, get the equipment. That will make it easy. So when the physician gets on, they're not wondering what's going on with you, because you have the numbers to show it and you've got equipment So if you say, hey, do you want to hear my heartbeat right now? It's like a $20 device. You pop it on, it listens to you, and you can ship it up to him. So with that, so what have you seen? I know that you've got little kids, Don. Other advice for folks that have younger children?
Well, we've got the pulse ox, and there's very easy. It just pops on your finger, kind of reads through the skin. It's again, peace of mind. It's good to know, and we have had historically, we got 3 children, and historically the first 2, both when they were very young, had asthma-like issues. Never diagnosed with asthma. Both of them are doing great now. But early on, we were always very careful. Like if we were traveling, make sure you had that pulse ox. We would make sure we had, a nebulizer machine, and we'd have, the rescue meds available. Because if you're, traveling's probably not a huge issue now. But it's still it's like peace of mind type stuff. And we'd always make sure we just had that on hand, and we, again, just be prepared. It wasn't like a fear issue. I was just thinking about what are the things that are in my control that I can do something about, and when you could do them for low dollar amounts. Our pulse ox, it doesn't read to anything. It's just, digital display. It was like $15. Is it as accurate as what they do at the hospital? Probably not. But,
no, guaranteed not. But it's still better than not having any number.
but if it says you're at 92%, now well, I probably am below what I'm supposed to be at, and it's time to go get checked out, right? So it's rather than going with your gut, you got tools to give you that feedback. So that's what we've always practiced. I mean, certainly now we're not traveling, but if we were traveling, we would be thinking about all the same things again. With current situation being what it is, what are the things that we want to have ready access to, so that we can take care of ourselves as best as possible. Now, my question for you is, going through all of this, like we collected this, we have this equipment, and we used it as indicators for ourselves to know when to go get help. We never had any idea that we'd be sharing this data with a provider as a major input to the work that they're doing. And historically speaking, that's always been kind of objection number 1 that I've heard to telemedicine, remote patient monitoring, everything else is, I don't know what devices you people are using. I don't know if they're, some crap knockoff device from China that doesn't work. I don't trust any of that data. Has that begun to change? Because obviously everybody's, posture towards telemedicine has changed abruptly. Remote patient monitoring is starting to look that way too. Are doctors becoming more receptive to this type of thing, or at least more open-minded to it in your experience to date?
Yeah, I would say open-minded, Don, but the reluctance is still there. And obviously, 3 months isn't going to make years of reluctance go away. What we do see, though, is if you have some data to be able to inform. So there's telemedicine, which we whether if you're on the phone or a video, audio, that's all telemedicine. What's really tough right now is telediagnostics. So if you have parents, if you have yourself, you have kids, and if the doctor is unwilling to take the input that you're giving them, find another doctor, right? Any doctor who says, well, talking to you is good enough, I'd rather not have, a device that might even be a little inaccurate or might not be perfect, that somehow just chatting with you is better than having that. It's time to really look for a new doctor.
Fair enough.
But at the same time, this is where if you have these issues, you're starting to look at, there are thermometers. It's not important in many, many cases that the absolute value be known across your readings. So it's not important that your temperature is 96.7. What's important is, what was it yesterday and the day before and the day before and the day before, and then that consistency. If it's remaining there, it's the relative change that we are often looking for, especially as a medical device builder. That's what I look for, is relative change, because the relative change is what I give alerts on. So some things, of course, are, an absolute value is very important. But like what's happening at this point is, you'll see in the New England Journal of Medicine, you'll see the FDA has a new emergency use authorization listing for all of the COVID tests that are out there. and there are dozens of different kinds of serology tests and the nasal swabs, et cetera. And a lot of people are starting to use test A versus test B. It really doesn't matter because even from the same manufacturer, you can have two different types of tests that should not be measured against each other. But let's say an entire family took the same exact test of the same exact type and then is doing some comparison. That makes sense. It's still not precise, like 100% precise.
Sure.
But it's more meaningful to say, I got an Abbott test. All five of us got Abbott tests, let's say at your house. And here's what the same Abbott test gave us. What I'm seeing a lot of family members accidentally doing is they've got 5, 6 people, they're getting their test done. One goes to a lab that does it with Abbott, another does it with a lab that does it with vendor B, another does it with a lab with vendor C, and they're like, why do all these look different? Well, because they're completely different tests, right? They're trying to show, with especially the serology ones doing antibody testing, is important to know that there are wide variations and wide differences. And so the good news is that the tests are there. The less good news is they're not always consistent, and that'll happen, by the way, when you do a pulse ox from one device, that $15 device versus the $500 device that the hospital buys. The value will be different because the absolute value and the accuracy will be different. But what you're really looking for is what was it yesterday and the day before and the day before versus what it is today and tomorrow and the day after. So as you look at that, that's what the physicians are not always completely comprehending, not because somehow they were untrained or whatever, but what they are accustomed to is when you go to the office, you have office equipment, and that office equipment is generally FDA approved. They've been working with them for a while, so they are comfortable with that. The only time I say, you want to find a new physician is one that believes no equipment is better than a conversation, right? Sorry, the other way around, that a conversation is better than any equipment that you might have access to. So the telediagnostics part is something that I'm hoping we, getting back to our health IT roots, right, our medical device roots, what should we be focusing on is not telemedicine, it is telediagnostics. And then following up with that is teletherapeutics, which is now that I want to do something, for example, telediagnostics can extend to labs. So what are we doing about labs these days? Well, it turns out that there are a number of companies that are now offering, an employer can now offer a test remotely. They can purchase a test which will come to your house. You can do your own swabbing, put the thing in there and ship it back out. Or the FDA has only approved very, very few number of these, but that will increase over time. What you can also do is get on. There's one where you can actually get on with a telemedicine call. Let's say, Don, you're my doctor. You will actually tell me, hey, Shahid, now take the nasal swab out of the packet that you receive, stick it way up there, and until it's hurting, don't stop. Right?
So they kind of walk you through it in real time.
Exactly, which means that the FDA now has said that, okay, the equipment can be remote, but you must still be there as a physician to walk me through it, et cetera, which makes complete sense because not everybody can do.
And it's still quite an upgrade because you can do that without the car ride, without the parking, without taking off of work, without, all those different things that you have to do today to go to a visit. This all can happen now. Instead of it being a 3-hour ordeal, it is a 15-minute, remote visit, if you will, from your home or from your car outside of work, perhaps, where we can, get some privacy. And, that's a huge step forward for anybody who's a patient.
That's right. And if you couple that with what you were talking about earlier, which is ask the employer, are they ready? And so when the employer says, not only are we ready, but here's how we're going to help you do remote testing. If you ever slightly do feel sick, we're going to send you right home. And then the first thing you're going to get, maybe even before you get home, is the lab test is going to be sitting at your doorstep. You're going to then follow. You're going to have a telemedicine call connected directly. They're going to help you do your test, put it in, get it out there so you can get your testing done remotely where possible. So what we'd love for everyone to do from a messaging point of view is get the message that there's absolutely nothing that is not possible to do telediagnostically if you put your mind to it and you find the right doctors. So remember 6 months ago, it was very difficult to say, hey, if one doctor is not doing telemedicine the way that you think is convenient, not the way they think is convenient, but the way you think is convenient, then you should switch doctors. That would have been a stupid thing for me to say, because 6 months ago it wouldn't have been easy for you to cross state lines and pick one doctor versus another, because there weren't that many. Now, when everyone is doing this, when I say everyone, that's not, we're not exaggerating. Literally everyone is doing this if they want to stay in business, and therefore you can be a lot more choosy with your, hopefully with the health plans being a little bit more open to it, etc. So what I like is that, so any smart physicians, clinics, hospitals are already thinking about this. So it's not something that you're going to have to leave your doctor over, but it's worth leaving them over if they don't
if they're there,
if they're thinking about it. That's right.
Now, there has been some reimbursement adjustments to support remote patient monitoring now too, right? We all talk about the telemedicine stuff all the time. That's huge news. But this, somewhat under the radar, RPM has gotten some support as well from CMS. Am I right?
That's exactly right. So remote patient monitoring had already, even with the CPT codes like 99490 and the chronic care management, the CCM, was already on the rise in terms of CMS's understanding of it. But it wasn't really being picked up as much in the marketplace because it's very difficult to get these programs set up. But now everybody's willing to go do these because, one, they're losing revenue from other sources. So this is a perfectly good revenue source. But try not to confuse for the audience. In our audience, don't think about telediagnostics as the same as remote patient monitoring. Telediagnostics is when you come on the screen and when the doctor tells you, hey, do you have an alive cord? Can you stick it at your chest? Right? That's a telediagnostic. Or, hey, stick the pulse ox on you. RPM is typically what you do when you're continuously monitoring. So you're part of a doctor's program that is monitoring chronic conditions and those kind of things. So we're seeing this nice connection between this. So the curves are matching now, where telediagnostics and RPM are starting to connect. And what I'm really excited about is that just very recently, probably in the last 10 weeks, I've spoken to at least 8 to 10 vendors who have been building IoT devices for many, many years, but now are saying, hey, I'd love to connect my my IoT, the Internet of Things, or these little devices, to an electronic health record. So what does that mean? Well, it means people are asking them about it, right? So they're not just doing this on their own. Some of them are trying to think about the future, but really most of them are, hey, our physicians that picked this up from Walgreens started using it, suggesting it to their patients, which is what, the thing that really I get excited about is the doctor who is thinking so forwardly now that they go find the equipment and then they tell their patients, please buy one of these. That has not been happening in the past. And we're at least seeing anecdotal one-off types of things where people are saying that. But what we want to cover in a future episode is a lot of RPM and what that means in these chronic condition scenarios. So for example, if you had a blood pressure monitor, if you had a blood pressure cuff packet and a kit with a thermometer, a pulse ox, a ECG, all packaged up and sent to a patient's house as a kit ready to be used, then that's really the remote patient monitoring that many of us have probably heard about in the past.
Right.
That is picking up in steam, as it absolutely should. But what we're seeing is that that the telediagnostics is starting to pick up in very small areas, probably faster than the full remote patient monitoring. So if you're an IoT vendor wondering what you should do, try to think about that model and say, well, what if I wasn't looking for full RPM and instead I can help telemedical folks be able to do remote heart monitoring, meaning when I say monitoring, I mean just like listening to the heart either through an echo or through this remote sound thing that we were talking about. So we should, listening to, as you listen to us in upcoming episodes, we'll be covering more of those. If you are a remote patient monitoring vendor, if you're an IoT vendor, and you're thinking about how to do that, come on, talk to us about, where you should go on to connect with EHRs, and we'll give you some advice here to make sure that our audience learns and our vendors can learn live. And that's where these kind of videos are very helpful, right? We're kind of like having a design session. That's what I would love to do, is have a architecture session, a design session. Why should you pick this model of delivery versus that model of delivery? Looking forward to that in a new video type of format.
Yeah, absolutely. It definitely opens up opportunities to us. And if you are tuning in here and you're interested in that, you can hit us at contact@thehcbiz.com. Send us your idea. Tell us what you want to talk about, what you want to work through. Absolutely, would be thrilled to do that. The other group I want to touch on quickly here, Shad, as we kind of head towards the end, is our software vendor friends that are watching, and our the SaaS innovators, if you will, that group of folks. One thing that comes to mind as you're talking through all this is about a year ago, we did a show with a company called VivaLink, and they provide that underlying medical grade, a piece of hardware that is the patch, that is, monitors temperature, heartbeat, all the things we've been talking about. Excuse me. And they make that available to software vendors with an API who, now you can add into your software application this medical grade, FDA cleared patch, or whatever piece of hardware you want to integrate with. So as always, you don't have to solve any full piece of the pie. There are a lot of different tools out there that can help you move the ball with this. So what opportunities do you see for that group of people, Shad, that is the software vendors looking to innovate in this space?
Yeah, I see a lot of benefit in those areas, and especially as they start to go after these physicians. So remember, there's going to be three types of hospitals and health systems and ambulatory centers. Those that recognize the beauty of telemedicine, they weren't doing it, they weren't going to get into it on their own, but during this, they were super innovative. They recognized the beauty of it, and they're going to, go full steam ahead, even post-COVID. Then there's a group that reluctantly got into it, and they're not going to really go accelerate on it after COVID kind of dies down, but they're not going to throw it away either, because many of their patients are going to care about those. And then finally, there's that group of physicians or hospitals or health systems, and I shouldn't say physicians because most physicians wouldn't be in that camp, but there are going to be those that want to just get the heck out of this telemedical model and go back to whatever that normal was pre-COVID.
Right. Sure.
So if you just look at the first two markets, forget this third market, and just that, when you're doing your market analysis, et cetera, just say, okay, this third market is not a useful one.
Is what it is.
Yeah, it is what it is. If you look at the first two markets and say to yourself, well, how would I build my marketing programs, et cetera, for that first group, which got thrust into this, but has no plans to go back, even if that's 10 or 15% of the market, that's still a multi-$100 billion market, right? Because everything in healthcare, even small percentage points are billion-dollar markets. And so if you focus on that group and don't even market to the rest of them, right? You don't have to. You don't need millions of these. You just need, usually in the low thousands to tens of thousands, you're very, very profitable over a long period of time. That's the group that I would go after. And when you start to think about, well, what does that number look like? You'll start to see that it'll be in the tens of thousands. And so these new market conditions, so if you're a software player that can make multi-device APIs, multi-instance, multi-tenant devices, software that can connect multiple devices. So for example, Azure IoT, a Google Cloud Platform already has the baseline infrastructure. What they're missing is, when I say missing, it's part of not their core business, is the consulting of the integration in the middle. So there's a lot of opportunity from everywhere, from building new APIs that sit on top of these GCP, Azure type things, all the way through to building your own. The next Twilio, for example, that is focused on medical IoT is ripe to be built at this point, right? Because the world is completely changing. So I couldn't be more excited about the ability for telediagnostics specifically, not just RPM, as being the next area where we should actually spend a lot of time and effort in the industry.
Yeah, right on. No, that's great advice. And, it's just, as always, there's just so much opportunity. Everything's always changing in healthcare. You don't always have a huge crisis like we have right now, but when you do, everything changes, creates new opportunities to add value to the system, to help the patients, to help the businesses. There's so much we could get into on that front. So like we said earlier, if you have ideas, if you want to come on and talk to us about it, please give us a shout out, contact@thehcbiz.com. And we'll continue to experiment with both our audio and video platforms. So, stay tuned for more of that, and maybe some whiteboards and screen shares, and who knows what comes next. So Shahid, always a pleasure to talk to you. It was a great topic today and very informative. To you, the listener and or viewer, you can find us at thehcbiz.com. That's where you'll find our whole catalog. Of course, you can find us on YouTube, Apple, Google, any place else that you get your podcasts. So please do check us out. And as always, just thank you for coming to learn with us today. We appreciate it. Shahid, have a great day, and we'll talk soon.
All right, you too.